Hey,
Hey,
there we go.
hey,
We
Jeremy.
got it.
It's working.
It's working. Can you hear me all right?
I can hear you great.
That's great. Are you okay if I record it just for future reference?
Say that one more time.
Are you okay if I record this just for future reference? I understand if you're
Oh,
not.
heck no. It's the whole purpose of doing it.
Yep.
Explode your mind a little bit.
Yep. Man, thank you so much. When I saw your comment, my immediate response for most people is normally I sort of ignore them a little bit because they feel like they want something from it. Either they want to make a sale or they want some significance. But with yours, I was very much straight away. I was like, he's just here for service. That was my impression. I really saw that, and I really
That's it.
appreciate that.
That's it, man. That's all I'm here for.
Yeah.
I was really taken aback by your post and really disheartened. But Jeremy, I don't know if you know my background a little bit. I'm an orthodontist, identification orthopedist, probably one of the top 10 GMJ guys in the world. And I deal with some stuff.
Yeah.
Crazy stuff. And whenever I see a post like yours, being an engineer at heart, I have a tendency to say, okay, if all you've got is a hammer, everything looks like a nail. And it seems like with your diagnosis and everything you're going through, everyone's looking at you as a nail, and they want to use their own hammer.
Yeah.
So I deal a lot in the ADD, ADHD world, have for about 20 years, mostly on younger children. But it dawned on me about 10 years ago that there's an impact on 30-year-olds and 40-year-olds, even 50-year-olds. And almost every one of them has the exact same type of bite. It's called a class 2 div 2 malocclusion. Sometimes a class 2 div 1. But you're excuse me.
You're right. Take your time. Take your time. No rush.
Still dealing with pneumonia.
Oh, I'm sorry.
Yeah, the COVID pneumonia is bad. So
Your pneumonia's bad.
yeah, I've been dealing with it for 2 weeks now.
Oh my goodness. I'm so sorry.
It is what it is.
Yeah.
It'll cure in time. It's just hard to talk, which is my job.
Well, you cough as much as you need. Take your time. There's no rush here. We're in a Delta lockdown in Sydney at the moment, so our numbers are still going up. So I've got nowhere to be particularly today.
Yeah, Delta's what I got, man. It's brutal. Absolutely brutal. So anyway, when you look at people who are class 2 div 2, it's hallmarked by a couple different things. Number one, an upper jaw that's more narrow in width than it should be. Usually between 6 and as much as 8 millimeters in width, narrowness than it should be. Now it's also hallmarked by the front teeth being rabbited back a little bit. And then it's also hallmarked by the lower jaw, where the upper jaw, lower jaw should be coincident like this.
Yeah.
The lower jaw is back, usually between 4 and 6 millimeters.
Okay. Yeah.
You've got that. You also see other things very commonly like snoring, sleep apnea, inability to focus. And this is something that's probably been happening to you since you're a wee little boy.
Yeah. Well, going through a lot of the markers and symptoms of ADD, there's like stuff in there that I'm just like, holy crap, it's been going on forever. Like as far back as my memory goes.
That's right. Right. So what happens is if your upper jaw is more narrow in width than it should be, your tongue is supposed to rest comfortably in the roof of your mouth. It can't. So it naturally goes backwards. When it goes backwards, it creates an issue with breathing, where you have to breathe more through your mouth rather than through your nose, or you breathe improperly to the point where your nitric oxide levels are reduced sometimes as much as 80%. Sometimes as much as 80%.
Okay.
So, what do you do to fix it? The answer is you've got to do something orthodontically, sometimes orthopedically, where the upper jaw is made wider between 4 and 6 millimeters.
Yeah.
The lower jaw is upright a little bit, developed, about 4 to about 2 millimeters, and that will help about 80% of people. The other 20% of people really need jaw surgery, where the upper jaw is made another 4 to 6 millimeters wider, and the lower jaw is advanced, usually another 4 to 6 millimeters.
Yeah, wow.
Here's the answer.
So it's that my nitrous oxide levels would likely be low in this case, not too high. Okay.
Guaranteed.
Yeah, I've never heard about this before. Like apart from people talking about scuba diving, as far as I can remember.
Yeah, it's Tony Robbins talks about it all the time. It's how he's able to stay on stage for 16 hours, keeps his nitric oxide levels up.
Okay, yeah.
So the thing is that a very simple way of doing this is find a local orthodontist, tell them all you want are photos, supplementary x-ray, which is a side photo x-ray, and a panoramic x-ray. If they charge them, I don't know what Australian health is down there for dental. Heard it's pretty good, but
generally, like we have pretty good public system. Sometimes you pay a bit, but last X-rays I got for the wisdom teeth wasn't too much. I think maybe 200 Australian, maybe.
Yeah. So it's not that big a deal, but get these photos, get the X-rays, and then I can walk you through it over a Zoom call. It's very simple. I can tell you exactly what you need. I can tell you exactly how to do it. And then the only thing you got to do is find an orthodontist who's willing to listen.
Yeah.
Someone who corrects this and fixes this all the time and actually executes.
Yeah. So that might be a challenge.
If you won't do it, then you won't get the benefit that you need.
Yeah.
Now, again, I've done this on hundreds into the thousands of children. Maybe only turned 50 adults that had issues like what you're dealing with. I never put 2 and 2 together. Literally. Reading your post last night was like, holy crap. I never looked at it this way. And that's silly. But then again, 2 weeks ago, I never looked at dying.
Never looked at dying.
Yeah, I was in the hospital.
Oh, really?
Literally. I'm sitting there and I know I'm developing pneumonia, and they're not working on it fast enough. And I know with COVID, the thing you got to worry about is the cytokine storm, and they're not responding fast enough. And I'm like, shit, if they don't do what they need to do, I'm going to die.
That sounds really heavy.
Yeah. And so, but what I can tell you again, in your case, Jeremy, is that, yeah, braces could very well change your world, change your life, change everything. Now, wish I could tell you that this is 100% solution. That without hesitation, you go through this process, you do everything as I tell you, and all the issues and mental health wise resolve. I can't tell you that.
Appreciate that you are taking that stance.
But I can tell you with great certainty. And I try not to speak in terms of absolutes. I try to speak in terms of predictive factors. If I had 100 Jeremys who walked in my practice, I know 95 to 98 of them would walk out significantly better and probably from a mental standpoint on a significantly better pathway. The other two, or one, who knows? Who knows what's going on? But to be honest with you, I ferreted out those pretty well too. I just have to be a little bit more proactive, in those cases. But honestly, treated more than 5,500 patients, Sir Jeremy.
That's a lot.
In orthodontics. It's very rare that I miss.
Yeah.
Very rare.
Mate, I really appreciate you just putting this out there for me. Like the thoughts over the last few days are, as I'm like going over and learning about the symptoms and just being like, okay, this is good to know, but holy crap, this is what I'm fighting against. What do I do about it? Like I'm already doing deep emotional coaching work, and it's great. It's helped a shit ton. Absolutely. But if my neurotransmitters and my neurons are just biased towards all these emotional struggles, then what the fuck do I do? Medication might help, but I was like, it's not my preference. And when you said that, I was like, whoa. It was some hope. You gave me hope. And it was like I can't describe it to you, man. It was like, holy crap. Maybe I don't have to be XYZ genetically predisposed to what this is.
It's true, Jeremy. And those are my favorite things in the world, is when people say, for the first time, I have hope. I love those words. It's just looking at things different.
Yeah.
So hopefully this will give you a first step toward taking, get those x-rays, get those photos as fast as you can get them. Yeah, we'll connect again on Zoom and I'll explain everything that's going on.
Yeah.
Have your doc send them to my email directly, or they can send the office email.
Yeah.
And it's a very easy thing, I think, to resolve. It'll change your world, man.
Okay. Well, I booked in to see the dentist on Saturday, and I told him I was looking for a referral for an orthodontist. So whether the dentist can get me the x-rays straight up or I need to go to the orthodontist first, I don't. You know better than I would.
The photos are the most important thing.
Photos over x-rays?
Yep.
Yeah.
The photos they have to be pristine. In the US, there's something called the American Board of Orthodontics.
Yeah.
The standard by which all orthodontic photos need to be taken. It's my expectation, that's what I get.
Yeah.
it's kind of like this. If you said you had a wart on your toe and you took a photo from 30 feet away, chances are pretty good I could see that there's a wart on the toe, but I really couldn't understand or see. And sometimes country to country, there's different standards of care.
Yeah. Yeah, 100%.
How else can I serve you, Jeremy?
Oh, you've sold me. Did you say sell me or serve me?
Serve you.
Serve me. Oh man, I don't know if there's much more you could do. Like everything you've offered, like is just incredible. I'm really grateful. Remember our time at Life and Wealth Mastery with you and AJ. You guys,
Oh yeah.
I really enjoyed hanging out with you guys as one of my preferences to most people. Something about you that just, I don't know, I just sensed that you were there to connect and be with people. It was that heart. It's not always there in that entrepreneurial space. You know, there's a big mix of energies going around if I speak spiritually.
Oh yeah.
And I think like even seeing you at Date with Destiny I was like, whoa, hey guys, this is cool. Was really nice. I thought Life and Wealth Mastery was a bit of a waste of time and money.
Yeah.
But the people I met there was particularly you and AJ and Jew have led me to some of what seemed to be some of the best experiences that I've had. So yeah,
That's awesome, dude.
glad.
We appreciate that.
Yeah.
All right, Jeremy, I'm going to get to dinner.
Yeah, I'll let you go and rest up, and thank you for your time. Like I understand it's valuable, so really appreciate it.
You bet.
If you have any fees for the consult, just let me know. I can transfer your money too.
I charge usually a pint of Guinness.
Pint of gas.
No, Guinness.
A pint of Guinness.
Or some other fine beer.
Oh, okay. Well, I can
So
buy
when
you
we're
a
in
case.
Australia, or if we meet in Ireland, or somewhere in between, you can buy me a pint of Guinness.
All right, we'll do. When I'm getting to traveling through all this, I don't know how you feel about the vaccinations. But if
I'm not good.
you don't like them,
What do you guys feel about them down south?
there's the two sides as there are. There's the skeptic side of we don't know what the results are here. You know, it normally goes through years of testing, and you know it's a worry. And there's the other side, which are like, well, we're doing the best we can to get rid of this COVID stuff. And you know, I don't know which one's right. I could guess which one I prefer, but could be either side. I don't know. And I'm not medically professional like yourself either. So
I'm very worried what's in it because they've not fully posted everything that's in it. So we've basically got same thing here. The vaxxers who believe that this is the salvation for mankind, and the anti-vaxxers who believe this is the destruction of mankind.
yes, it's very much what it is.
And there's not much in between. So
really good way of putting it, actually.
yeah.
No.
So it's very, very interesting. We're in a really wacky world right now. I can't believe you guys are locked down like you are.
Yeah, well, we've mostly been open until about 6 weeks ago. We had one lockdown that lasted about a month or two in Sydney. Melbourne had a lot. Melbourne's had a shit ton, actually. Sydney and the rest of Australia mostly have not been locked down until now. This is way harder than the first wave as well. Like I was working all through the first wave in the construction industry, and now I'm not. So it's, yeah, I don't know what's going on exactly. I could guess that they're telling the truth. Very rarely that's 100% the truth, even if it's close.
Yeah, they're not allowing any true information out right now.
Pardon?
They're not letting any true information out right now.
Yeah. And then of course I've only just seen it passingly. There's the whole situation in Afghanistan, and then bringing in the refugees, and people may die under Taliban for being US sided. So it all feels very World War II era kind of reminiscent.
Yeah, it does.
Soviets versus Nazi Germany versus the free world. It's, yeah.
Right. Where the Nazis think they're the good guys.
So do the Soviets.
Yeah. Yeah, it's so. All right, Jeremy, I gotta go.
All right. Thank you so much, and really appreciate
You
it.
bet.
And I'll talk to you soon and let you know as soon as possible when stuff comes through. I really
Sounds good,
appreciate your
bud.
time.
No worries. Talk to you soon.
Bye.
Good night.